Hello, thank you for your interest in this supplemental information to the Colorado Behavioral Health Administration's February 2nd, 2023 Community Forum, which provided updates on the Behavioral Health Administrative Service Organizations, or BASOs. During that discussion, information and a data analysis was reviewed related to the proposed two-region BASO approach. The BHA also shared an alternative three-region BASO approach in response to stakeholders who suggested more than two regions be considered. This presentation provides additional information related to the three-region approach as shared with stakeholders. The primary goal of the BHA in establishing the BASO regional structure is to ensure equity of services in each region and maximizing funding for services. BASO regions should also be balanced in terms of demographics, behavioral health need, and behavioral health services utilization. The BHA received feedback from stakeholders through an extensive process and took recommendations and insights from that process into consideration when developing the proposed regional approach. Stakeholders suggested fewer than the current 7 RAY regions, but also did not want RAY regions split across BASOs. They also recommended alignment between and across intermediaries to support an effective service continuum and care coordination efforts. Streamlining and maximizing efficiency was also important to stakeholders. In addition to the two BASO regions discussed in more detail during the February 2nd Community Forum, an alternative three-region approach was shared. The same goals of ensuring equity of services in each region and maximizing funding for services was foundational. In addition, the balance of demographics, behavioral health need, and utilization were considered, along with minimizing administrative burden. As you can see from this map, BASO 1 is made up of RAY regions 1 and 6. BASO 2 is made up of RAY regions 2, 4, and 7. And BASO 3 is made up of RAY regions 3 and 5. The same analysis was performed on the three-region approach as the scenarios in the two-region approach. The same 28 factors were considered across the 7 domains listed on this slide. The domains include geography, which included the number of counties, population demographics, which included factors such as the regional population who are Black, Indigenous, and people of color, as well as age and poverty level. The behavioral health need, which included factors related to adults with poor mental health and the safety net population in rural and urban communities, as well as the poverty level. Medicaid utilization, which included factors such as percent of Medicaid members with a mental health diagnosis who received at least one mental health service in the previous year, and percent of Medicaid members with an SUD diagnosis who also received at least one SUD service. The continuum of behavioral health service, which included the average number of behavioral health services across the continuum. The provider network, which included factors such as the number of Medicaid providers billing behavioral health services and number of behavioral health disciplines per 1,000 residents. And finally, the healthcare utilization, which included factors such as the number of behavioral health related emergency department visits and the number of adults who visited a primary care provider in the last 12 months. A full listing of the factors included in the analysis can be found on slide 19 of the February 2nd presentation. The slides that follow show 3 examples of the factors that were looked at: how people who are BIPOC are represented in each BASO region, how the adult population with poor mental health are represented in each of the BASO regions, and how the number of Medicaid providers billing behavioral health services are represented in each BASO. These are the same examples that were used during the February 2nd meeting to illustrate the two BASO approach as well. Chart 5 shows the percent and number of Black, Indigenous, and people of color in each of the 3 proposed BASO regions based on the number of people living in Colorado. Chart 6 shows the percent of the regional population who are BIPOC based on the number of people living in the BASO region. It's important to look at these factors considering the health disparities associated with this population. Chart 9 shows the percent of the adult population with poor mental health among all adults in Colorado with poor mental health. The extent to which the adults with poor mental health in Colorado are distributed evenly across the BASO regions is an important indicator of behavioral health need and a risk factor for crisis events if needs go unmet. Chart 16 shows the number of Medicaid providers billing behavioral health services in each of the proposed regions. This is an important factor given access to care is impacted by system and provider capacity. The number of providers is also an indicator of provider choice within a region. Again, thank you for your interest in the BASO implementation. Please continue to visit the BHA website for updates and additional information. The BHA has also posted the recording of the February 2nd Community Forum, along with a copy of the presentation at the website indicated on this slide.